Welcome to the CEO and the Salesman Podcast. I'm your host, Matthew Whyatt. I'm the salesman part of the title. Each week, I sit down with CEOs and entrepreneurs to discuss and dissect their journeys, filled with triumphs, challenges, and some good old-fashioned business wisdom. Get ready to laugh, learn, and be inspired as we dig into leadership, strategy, sales, marketing, and everything in between. This is the CEO and the Salesman Podcast. Let's get on with the show. Today we're joined by Klaus Bartosch. Really happy to see you today, Klaus. How are you?
Yeah, good, Matt. Thank you. Looking forward to seeing where the conversation leads us.
Well, actually, so normally I do a bit of a quick intro. So, Klaus, you've been a startup founder. You've listed companies on the ASX. You've written for cancer, and you've actually been chairman of a charity. So, I want to try to cover all of those things today. But firstly, I want to ask you, how did your business save your life?
Oh, gosh. So in 2013, 2 years into my last startup, which amongst other things enabled people to take action 24 hours a day, 7 days a week to schedule an appointment to see their doctor. And at 9:30 one night, I was getting ready for a charity ride to raise money for cancer research of all things, together with a large team. And we're about to do 6 rides. I just finished my first one, so 5 more rides around Australia and New Zealand, and they were 200-kilometre rides over 2 days, so reasonably significant rides. And I had a problem. I have arthritis in my right knee, and my knee was getting pretty grumpy. And so at 9:30 one night, I'm sitting there at home complaining about my knee, and my wife kind of, comments from the kitchen that I should stop complaining and just get online on my app and schedule to get an appointment to see my GP,
on your own business's platform.
Yeah, which I dutifully did, and that led to a discovery a week later that I had a rare form of leukemia, was immediately hospitalised, and was essentially fighting for my life. Got through that okay. But yeah, it was an interesting moment where people talk about early intervention and prevention as enabling better outcomes. Well, here I was able to take action at my moment of worry or concern that led to a discovery early that had I not done so, I'm told a week or two later, I wouldn't have been here. So certainly quite profound, and I think helped me really better understand why what we were building as a company was so profoundly important to people's lives and well-being more generally.
So did you become more of a evangelist for your business after that?
I don't know if it became more of an evangelist. I think what it allowed me to better understand was the mission and story behind how to convince others that what we were doing mattered and why they should get on board. So, all these things, when you experience something personally, it gives you a perspective that is, quite different to what you might otherwise have.
And did you engage with any charities during your treatment, or did you have much exposure to them? Because I know that you've been a board member of charities, but did you actually get to see it from the other side?
So what's interesting is I was immediately hospitalised and placed into isolation, and at the time was raising money for cancer research for a set of rides that were then called the Rides to Conquer Cancer. And they had on average between 1,000 and 2,000 cyclists on each of these rides. So they're big major events. And in order for you to be eligible to ride, you had to raise $3,000 minimum to be able to do one of those rides. And I'd never raised any money for charity properly in my life prior to then. So it was a pivotal moment in helping me realize that I had the capacity to not only raise money and raise funding for a charity, but bring other people on a journey to do so as well, who shared the same vision and image and desire to wish to make a significant impact. And we called the ride that we're doing that year the Grand Slam, which was all 6 rides to conquer cancer, and had to raise $3,000 for each of those rides. Many of us raised much, much more than that. But I unfortunately couldn't get to complete those rides with my colleagues. They had to do so without their team captain.
To cheer from the sideline.
Yeah, but what it did do is later, some years later, a few years ago, I joined as a board member of a group called Melanoma Patients Australia. It's a not-for-profit charity to support people who experience melanomas, both the patients themselves and their immediate families. And while I had experience with leukemia, my reason for doing Rides to Conquer Cancer was because I was originally diagnosed with a melanoma back in 2000. And I've since had 6
Right.
others, so 7 all up. And so those experiences have led me to make commitments and get serious about seeing what I can do to have an impact outside of just what you do for work.
Fantastic. So the impact brings me to your current role as mentor for startups and scale ups. So could you just tell me but just staying with the charity piece, what's the difference in headspace for you when you're a board or advisory member to a charity and a startup? Is there a difference between those two ways of thinking?
Um, that's an interesting question. I'm not sure I'm going to do the question justice, but let me try and answer it in as best a way as I can think about it, which is that um, when you are building a company, you need to think deeply about um, who benefits from what you're creating, how you're going to get those customers or payers on board, and how you're going to get them committed and interested in what you're doing. And at the end of the day, people buy products and services that they have ideally a passionate belief about. And so,
Mm.
I went from my last startup to starting a venture capital company combined with a technology and commercialization studio focused on helping health tech founders and specifically to bring their products and services to market, and have learned over the years and have the scars, frankly, to prove it, of all the ups and downs of what it's like to be a founder. And so I think with a charity, you're dealing with, I guess, a problem from a different perspective in that you've got a mission as a charity for the services you're seeking to provide, for the impact you're wanting to have. In the case of Melanoma Patients Australia, to assist patients and their carers and immediate families with the journey they're now embarking on in dealing with melanoma, which is a very different kind of cancer journey to other cancers, I might add. But you're also needing to convince funders, the payers, businesses, philanthropists, to support what the charity does. And what the charity does is its mission to support the end users that it's seeking to have an impact around. And so I think you end up going through a similar process of how to identify how you're going to succeed in what you're doing and unpack essentially, what market you're wanting to address, what value you're seeking to provide. Is there an opportunity out there? Can it be properly commercialized? And how can you validate that what you're trying to do is people genuinely want and are willing to pay for? And they're all, I think those characteristics are the same whether you're doing it for a charity versus a company. But the major difference, I think, is that when you're doing it for a company, the payers are usually the customers that you're providing the product and services to. In the case of a charity, the funders are rarely the beneficiaries directly of what you're doing. They're supporting the mission of the charity to deliver a service to people.
Has it changed how you sell?
I don't think so. I think over it changes your mindset because you need to think. You need to properly understand who you're engaging and what they're wanting and what and how the outcome is. So there's a difference, but I think the fundamentals remain the same. I mean, I remember when how I first got into sales. I mean, I'm civil structure engineer by background, spent 10 years in the construction industry, landed in technology as part of that journey, and was working with a what was then called a computer-aided drafting system for the drawings that we were creating, and found myself then working for the vendor of that technology platform and joined them to head up their customer support function. And from there, found myself doing marketing, and from there found myself going out and talking to customers and trying to figure out how we could best help them. And that kind of landed me in sales. And my perspective of sales back then was it was a dirty word, that salespeople
Yes.
were somehow dishonourable, not to be trusted profession, and discovered that
Yeah.
while that might be true of a cohort of salespeople, I think the best salespeople on the planet have some pretty important things in common. They are, yeah, it is a profession, it has a process, it is heavily geared towards driving the right and best outcomes for your customers. And there's a process for how you go about doing that successfully, whether you're doing it to sell a TV at JB Hi-Fi, or whether you're doing it to sell a complex multi-million-dollar solution to a customer. But
Got it.
selling has a very specific and very real process.
So, in relation to the skills that it takes for let's talk about your experience as a startup and scale up mentor. So, in the skills matrix that are needed to actually grow and deliver a product to market, where does sales fit into that hierarchy of needs, I guess you could call it?
Oh, I think, what is selling at the end of the day? It is helping convince others of the value and merit of what you're providing, and that it meets a need that they have. If you're a startup and leading a company, then you are fundamentally convincing investors to get behind what you're doing, convinces customers of the merit of the product you're seeking to build or bringing to market, convincing employees that this is a company worthy to be a part of, and the mission of that business is worthwhile, and convincing your own family to get behind you and back you on what is ultimately going to be a pretty interesting journey. And if you unpack all of that, what is all of those things? All of those things are selling. And
Yeah.
hopefully doing so in a way that you're being honest to yourself about the reality of what you're dealing with and facing, versus what I see all too often, which is people having, um, you know, uh, overly biased views, or not objective views of what they're actually doing and how and why.
But mate, you're absolutely right. The selling to the family, I had to smile at that. When I started my first software business, I was 22, and my wife held a role as in accounts receivable for a listed company, and she absolutely hated that job. So it was almost a weekly sale of this is going to get better, we'll be okay. She only had to have that job for about 4 or 5 months before we were able to make her an offer she was more than willing to accept. But yeah, and also, when raising capital, also found that having those conversations internally and being able to convince you not only just your family but yourself and the broader network is a real delicate job when it comes to sales. So when it comes to your experience, you talk about so in your profile, and we talk about sales and marketing strategies, and you've grown multiple companies or worked inside multiple companies in the ASX, listed and exited. Now you're helping businesses grow as well. What's in B2B world? And I'm happy for you to talk about health tech in particular, because that seems to be your space. But what's the most effective marketing strategy that you've seen deployed, either yourself or seen other people deploy?
Oh, geez, so it's interesting. You say marketing, and then you also talk about sales, and they are different.
Yes.
They're not the same thing. And so, I think, and I've worked in multiple industries, so healthcare and health tech is just one of them, and I can easily talk about any variety of other industries. They all have their nuances and differences, and I think what people fail to do successfully is sit back and properly. So if you're in sales, for example, what's the job of a salesperson? Is it to build a big pipeline of potential prospects and convince those prospects to buy your products and service? That's what you would hear often from
Yeah.
salespeople, and it's entirely not the right strategy and approach.
Yeah. That's my, whenever I've been in sales, or I am in sales all the time, but when I've been specifically, as I was growing my business, my most effective moments were spent on on a desk in the sales room, and putting sales on the board. And my back book, or my pipeline, was always the thinnest, because I would actually ask genuine questions that elicited a genuine answer. And so the salespeople that worked for me, and I've trained in over the course of the last 8 years, the ones that tell me about their massive pipeline, they're measuring the wrong metric, I believe. The ones that actually are closing the deal and moving the people through the pipeline, that's actually the metric that I'm interested in. What about you?
So the technique I use to help salespeople think fundamentally different, and it's a technique that was shared with me by a colleague some decades ago now, and it has pivoted the way I think about all of this stuff more generally. And that is that the job of a salesperson isn't to convince the person in front of them they should be a prospect. It's to, as rapidly as possible, remove them as a prospect. So the job is to qualify them
Yep.
out, not to qualify them in, and to do so fast. And if you're going into a sales call with the view of qualifying an opportunity out, you will end up with a pipeline of things to which 80% of them you will close, rather than the 20% that most salespeople close in their pipeline. I mean, just because a prospect may benefit and have and could benefit from your product doesn't mean that where they are right now in their cycle of buying is that they're ready yet to buy. So don't waste your time. Put them on a different list and keep them nurtured and supported, but focus your pipeline on stuff you can win, and that means asking qualifying questions that rule them out. And most salespeople don't follow the rigor of how that process works. I mean, how many salespeople do you know have sat down and bothered to write down what are the top 10 qualifying questions they need to ask in the first meeting? Most don't.
Oh man, Klaus, I tell you, it blows me away. I go into businesses all the time with 1, 2, 3 salespeople. They're relatively small. They're not giant organizations with 50 people. Once you get to a certain size, then management occurs, and then those things are looked after. But businesses that are trying to break out of that $3, $4, $5 million range, they've extended their runway, or sorry, they've burned out their runway when it comes to friends and family and referrals, and now it's time to go out to the market. So rarely, I would say almost never, do the people actually sit down and write out a series of qualifying questions. And also, I was just working with a client an hour ago and say, what are the characteristics of a good quality customer? And it was quite painful and this is the CEO, and he understands, he's quite a smart guy. But I had to really drag it out of him. What are the characteristics? Not just qualifying as in name, rank, and serial number, because any person could do that. You can go to ChatGPT and say, what's a qualified customer? But actually, the attitudes and values of your best customer. And once we can identify those, then you've got a live opportunity on your hands, because then if your values as a business and the customer's values can align, or at least you can have the customer want to aspire to your values, then you've got something worth talking about.
I have a few classic expressions that may come through in some of the call today, but one of them is sell the customers you want.
Love it.
Right?
Absolutely.
So you don't need every customer.
So
you want the right customers. If you get the wrong customers, your business will find itself dragged into, you'll find that there'll be a half a dozen customers dragging 80% of the resources in the company because of the wrong customer. Be prepared to let the wrong customer go. I learned that the hard way. If you happen to get the wrong customer, just say, sorry, we're not for you. Release them from their contract and tell them to move on.
All the best. So I think about customers, I categorize them in A, B, and C, and that's not A for good, B for average, and C for crummy. I actually think about them as absolute. These are our best customers. If we just had a book full of them, life would be a breeze. Happy to have a beer with them, so to speak, a cup of tea if you like. But, these are your best customers. A. B is for beneficial, trade and exchange. The problem with a lot of businesses, and certainly in SaaS and startups, is they go, well, we're going to sell 1,000 of this cohort of people, but they're convenient clients. And that big fat bottom of convenient clients, I'm thinking about a triangle here in relation to a fat bottom, those people do drag your customer service into the quagmire and very rarely release them. They're 20% of your revenue, 80% of your pain, and it's actually way more beneficial to, as you said, release them from their contract. It hurts, but in doing that, I often and have in the past sacked clients, and that sounds like an uncharitable way of dealing with something, but I'd want to deal with clients who are the right fit, who I enjoy working with, and who listen to what I've got to say. Yeah, and often those people are very high paying. I release them, and always able to replace them with better clients. There's never there's never a lack of clients that are out there in the world. It's a lack of focus when it comes to a business as type of customer they want to approach.
There's a story I remember reading once that really appealed to me in terms of both what's right and wrong about marketing and what's right and wrong about sales. And it's a story about a car rental business that had every year it would fill a stadium full of its customers. 80,000 people would roll up, and in that stadium, the owners of this business would look around and feel great joy and comfort from these great loyal clients. The following year, they ran the same event, and 79,000 people showed up, so 1,000 less. Stadium was full. Everything looked rosy, except their bottom line looked crap. Their revenue had plummeted significantly. What had happened was a competitor of theirs had figured out which were the top customers for this business, went and stole them. And so they lost 1,000, had no idea that they lost their most profitable customers as part of that process.
Yeah.
And so, when you're dealing with high volume customers, really understanding your data and your numbers becomes incredibly critical. Like I say to salespeople all the time, it's 80% planning, 20% selling. They're like, what do you mean? I said, make sure you really understand who it is that you're selling to and why and what you want from that first call, and they go, what do you mean? I said, well, do you know anything about their position in the organisation, what their political influences are, what the alignment is, how long they've been there for, how their colleagues think about them, who their family members are, whether they've got children or dogs or cats, and what their preferences, what they like, what they dislike, what kind of food they like, what kind of music they like. All those things matter. And these days online, you can figure most of that stuff out. But the more you know about someone, the more likely you're going to resonate with them. And that's the reality of successful selling. Marketing is that's a whole complex area in itself, and it's the black hole that most companies struggle to succeed in. They just don't understand, spend money on direct emails, text messages, digital ads, to which they'll end up finding this, the black hole that'll suck every dollar out of your pocket in online digital ads, and wonder why it's not working for them, or worse, as someone once said to me, as a marketer in a business, and it was a source of great frustration for me. What a great exhibition we had. We handed out 4,000 brochures. Who cares? Who cares? Right? I got 5,000 clicks. Who cares? Those numbers are irrelevant. How many people purchased?
Wrong metric.
How many people purchased? How many people signed up to want to be spoken to following an event to learn more about your product? Those are the metrics that mattered. And that's the problem with marketers and marketing, is that they don't focus on the metrics that actually drive business growth. And they don't think about the messaging in a way that is sensible and accurate. And so whenever I spend time mentoring and talking to founders, I talk a lot about what's your commercialization strategy? What are the underlying, is there a market there that actually wants what you have? Have you validated and proven that? How many prospective customers have you actually spoken to before you went out and built the product that you're building? Have you thought through pricing strategy properly and sensibly? Have you considered carefully how you're going to differentiate yourself versus other competitors in the marketplace? And there's a whole range of things you have to work through objectively. And people, as you might know, Matt, the brain is wired to look for confirming evidence for why you're right. When in actual fact,
absolutely.
What you should be doing all the time is looking for why you're wrong. And if you can rewire your brain to look for why you're wrong, you will actually end up in a better place more often than not.
Interesting you should say that. I was speaking to many years ago. I was involved in some stock trading, and one of the mentors there would say, find a reason not to place the trade. Because you can always find reasons why. Pick a business, Telstra, any business is a good trade because, here's the 6 reasons. I was monopoly and so on and so forth. But, why is it not a good trade and what's the time frame? So interesting that you should bring that up. So you brought up a whole range of things that startup mentors or startup mentees and startup people should be thinking about. You mentioned pricing strategy. Do you have a way of thinking about that?
Oh yeah, 100%. And it starts with just unpacking the value chain. Who are you creating value for, and what is the impact of that value? And it'll often lead, by the way, to you realizing that the people you're selling to aren't the people you should be selling to at all. That there are other people who are bigger beneficiaries of what you're doing than who you think you're selling to. And so it'll often lead to very interesting outcomes from that perspective. But certainly, look, pricing strategy, it's a podcast in itself, probably more than one. It's not a trivial subject, and one that needs lots of careful, considered thought, and a lot of testing and validation. And so I think working through the value chain is important. Understanding how much value your product is creating for the payer and for the other beneficiaries of your product becomes critical to determining that, because ultimately when you're positioning your price, you shouldn't be selling on price, you should be selling on value. Price should become irrelevant. It should be the last thing the customer cares about. If once they've understood value, all of a sudden your price can be in a realm that you never thought possible. If you're creating $100,000 in value for someone, but you're charging $100 for your product price, there's a disconnect there that is significant. And so really understanding that becomes a really important part of the equation. And the next is, pricing strategy is also around how do you get people to buy, the difference between kind of gold, bronze, and silver versions of your product. So what's the right strategy for that? And there's some terrific, well-documented methodologies for how to get people to buy the annual subscription versus the monthly subscription option, for example, and how to buy the next version up, which more features and functions than the other, and how to make sure you're converting customers from a freemium product into a paying product. So there's a lot of things to unpack and consider when you're dealing with pricing, and how to manage and handle that.
So when you're thinking about startups and working with startups, and I do want to talk about your experience as working inside and being the CEO of a publicly listed company, but I just want to stick in the startups just for a second. When thinking about those people, where do you see the freemium model breaking? Because a lot of businesses that I'm working with, they offer a free trial, and it seems that it actually stops at the free trial. Like the through line of actually turning that into revenue has some real challenges. Have you seen that?
Yeah, well, there's no incentive to move away from free, so why bother? So if you think about one of the most effective freemium models out there, it's Dropbox. Sign up for free, get 2 gigabytes of storage for nothing for life, no cost. When do you pay? You pay to get more storage. Easy. And how do they drive additional users? If I want to share a Dropbox file with somebody else, well, gosh, that person has to download and be a Dropbox user to be able to access the file. And next thing you know, they're now. So it depends on. I mean, freemium is misunderstood and misused by too many founders. If you haven't thought through your commercialization and pricing strategy and how you're going to move people from a freemium model into a paid model and what the right incentives are to do that, haven't considered it properly, then you'll never ship them.
And are there any guides, books, people should be talking about to be able to cross that, to go from one to freemium to paid? And you talked about pricing strategy being a huge topic. Is there somewhere you could point somebody who's listening to this and goes, hey, I need to figure this out?
Yeah, look, I mean, there is a book that I think covers this well. For the life of me, I can't remember the details of it. What I might do is share it with you after this podcast, and maybe you can include it in your links or materials somewhere. But there
I'll put it in the show notes, definitely.
There definitely are pricing strategy books that are quite useful. what I would highly recommend every founder does is that there are a few books that they should read. I have a LinkedIn post where I identify 5 books every founder should read. And one of them, which is critical to any business, is how do you develop strategy for a company? And by far the best methodology and clearest process for that I've seen anywhere ever is the playing to win methodology. There's a book, it's called Playing to Win.
Who wrote that?
I got it next to me right here. It's my one of my gospels. A.G. Lafley and Martin. So A.G. Lafley and Roger Martin. It's called Playing to Win: How Strategy Really Works, and it is sublime. It just
fantastic.
Absolutely, every founder should read it and utilize it as the framework for how they develop strategy for their businesses. It'll help them work through all of that, including helping them think through pricing to some level. But pricing strategy is its own kind of hard knacker. And the others kind of important books are, 0 to 1 that I'm sure everyone's heard about, and The Hard Thing About Hard Things are, are really quite critical founder books that every founder should read and wrap their heads around, because the journey, every business is an overnight success after the first decade.
Yeah, absolutely. How long did it take you to get your business to, from you were a co-founder and a general manager and to getting it onto the listed at the ASX? How long did that take?
So 2011 is when the company was founded. 2015 we listed it via an IPO. I then ran it for a further 7 years as managing director and CEO of a listed vehicle through multiple capital raises. It was a interesting and challenging journey. In the end, engaged 18 million consumers, brought on thousands of healthcare customers, and did a lot of good. Some shareholders
saved your own life.
Some shareholders didn't. Yeah, and I got to benefit by living from it, which was pretty cool.
Indeed. So when to the headspace of a founder or an early stage startup person, it feels like you're in the scrum of things. And I haven't. I've run a business of 70 people, but that was nowhere near the rigor that's required to be part of a listed company. How did you cross the chasm from the headspace of founder startup, Klaus, to operating and running for 7 years an ASX listed business? What was that journey like?
Look, I've from my perspective, relatively easy. We ran the business from the outset like a listed company. So we had good governance, good board processes, and and managed it fairly formally as a business. And I've always enjoyed engaging and working with shareholders, which most founders don't, and I think that's a mistake. I think if you can listen to your shareholders, work with them, and you'll find them incredibly supportive and very useful, and often have very good insights for your business as well. So, from my perspective, I found the journey relatively easy, although as a listed vehicle, you are on display. You're no longer able to operate in a competitive way in the same way. You're in a glass house. Everyone can see everything, and including your competitors. And so it can be both a useful thing and an unuseful thing. I think for us, it gave us greater credibility in the market. It proved to be more useful. It certainly enabled us to get access to capital more easily. But with it came the burden of being, responsible to, in my case, some 1,500 shareholders in the end, of which 50 owned the majority of the business. And so, there's a lot of responsibility that comes with having a listed company. But it's, I think it's an interesting and good journey if it's done well. And we've had had some difficult times. I mean, gosh, when COVID hit and we're all in lockdown, of which my customers were all in the front line, also in lockdown, I'm sitting here going, are my subscription fees going to dry up tomorrow? Are we going to be kaput in 2 months? That was an interesting time in itself.
Did you change the model? Did you have to respond to that condition, or was
Yeah,
it evident really early?
no. So look, I mean, frankly, I described the first 2 months of COVID as the 6 months leading up to the listing, the most intense periods of my career at that point.
Right.
They were pretty full on experiences, and in the case of COVID, we had circa 60 people that all moved to working from home instantly. Had to engage really effectively online to make sure that everyone was being properly supported and performing well. In the end, what happened was we ended up with a 30% uplift in performance, tighter and better engagement and collaboration across the team. So, and everyone very committed to supporting what we're doing, in part because our customers were at the front line. So we felt their stress and their pain every single day.
Got it.
And we needed to develop new capabilities and new product capabilities as rapidly as we could to try to support what they were doing in the marketplace, including with telehealth. So, it was an intense time and a very interesting time. And in hindsight, hindsight's also was a beautiful thing. There are things I would definitely have done differently.
Right. What would you have done differently?
So I think that because we were scrambling with an overriding perspective of we just didn't know what the future held, and therefore whether we would continue to be viable or not. We scrambled to build product capabilities that in the end weren't actually used. And I don't think we took enough time to think through much more rationally and carefully what it was we're building and why we're building it. I think that because we had such a large customer base at the forefront and we believed in the need to continue to support them, we chose not to restructure the underlying cost base of the business. And we retained everybody. I think in hindsight, that was a mistake. It was the right thing to do at the time for people, but I think it would have been smarter to have taken the opportunity to restructure the cost base. We were still a business at the time that was burning money and investing for growth. And we had an uncertain future ahead of us. And I think, the board and us should have sat back and thought more strongly about, was this an opportunity to rethink the way the company was structured? And I think in hindsight, we should have done that. So we made what I would regard as a few strategic mistakes that I wished we hadn't made.
Right. And so did that eventually negatively affect the exit when you did leave?
Yeah, I mean, what it did was, we invested in building capability that never got used, so effectively wasted capital building things that never generated revenue. That's never a good thing in any early stage company, right? And it's one of the reasons why when I now speak to founders, I have them very, very rigorously think through their commercialization strategy and validate that there is a market opportunity for what they're going to build before they build it, versus what most do, which is build it and hope they will come. And that's often not wise. There are some circumstances where that's the only way you can test a market opportunity, but that should be rare, not common.
So, but the founders that you see and you mentor, you work with on a monthly basis, many of those would have to be coming along saying, "I've got an idea, and I've built an MVP," because they've read a book about building an MVP. And then how do you, in a loving and caring manner, approach the subject of getting them to understand the value of actual market size and commercialization? Or do you just hit in between the eyes?
With brutal transparency and honesty is the simple reality, because there's no point in beating around the bush. We don't have time. And to kind of unpack some of what you've just said, so I've now spoken with over 200 health tech founders in the last 12 months. We have a dozen that we like. Of those 200, the vast majority fall into the camp of will only ever be nice small businesses. And as a venture capital company, we don't back nice small businesses. We back companies that have the potential for massive global transformation, and they're the ones that we're spending a lot of time with. In health tech, the one thing you see that is why we like the category is highly passionate, highly committed, highly motivated people with real purpose in mind. And that isn't to say that other industries don't have some of that, but in healthcare and health tech, you see that as being a really strong driver for why people are doing what they're doing.
Is that why you're in health tech mainly? I mean, obviously you've got the background in health tech, but you also said you came from an engineering space and software space with CAD. But your health tech, it sort of gets you excited, does it?
It does, but the reason that I think we're focused in on it is that it is the category, the one category on earth that is in the biggest trouble. We talk about climate as being problematic, and no doubt climate change is problematic. But the reality is that the way healthcare is being done and delivered today simply will not survive in the next decade. I mean, healthcare today hasn't actually fundamentally changed the way it does things in the last century. Just let me pause there for a moment and have a think about that. And you'll go, sure, our healthcare's gone through lots of change. No, it hasn't. You still have to call a practice to book an appointment to see them. You still have to go in there and sit down and waste your half an hour or 45 minutes waiting for them to see you. They still only spend 2 or 3 or 4 minutes with you doing what they do. And they'll still only write you a prescription and send you out the door. The blood pressure machine that they use to do your blood pressure, by the way, is a 100-year-old device that operates the same way it did 100 years ago, and they're not calibrated. Therefore, you don't know if they're accurate or not. I could go on and on and on and on, but if you think about all the things we do in healthcare, fundamentally, it hasn't changed the way it does things. And there are known challenges and problems in that category in the industry. And so here we are at a time where AI, virtual reality, the power of the mobile device that you now have in the palm of your hands are capable of things they simply were not capable of 5 years ago, let alone 10 years ago. And so I think health tech has the greatest potential to completely transform the way healthcare is done and delivered globally by moving the industry from a reactive posture, as in you've now got a symptom, let us see whether we can fix you, to being a more prevention, early intervention, early detection oriented posture, where we're going to help you live a long and healthy and good life by helping you avoid the downstream likely diseases and conditions that you're going to or may experience because no one's bothered to tell you about the things you should be doing. So,
is that trying to move the public consciousness or public relationship with the terminology from lifespan to health span?
100%.
Is that the sort of
that's exactly
thinking
right.
you're going on there?
That is exactly right. And I mean, think about it, right? Like we all are. You more maybe than me, because I think you're younger than I am. But to these days, getting to 100 is almost a no-brainer. My children getting 120 will become the new norm. And that means that if you're retiring at 65, you need to be able to continue to support your lifestyle for another 50, 60 years. Well, goodness knows how you're going to do that, let alone what kind of life and quality of life are you going to lead, right? And so aging population, diseases, all sorts of things are such that, health tech and health tech innovations have a potential to have a profound impact on the long-term health span or quality of life you're going to be able to lead in your later life. And there's no doubt in my mind that massive global transformation is what's going to drive that. Because right now there isn't a government hospital system or private health insurer that isn't frankly shitting itself about how it's going to fund the way it does healthcare over the next decade.
Yeah. And so with that, are there any particular areas that you're focused on? I mean, health tech's so broad. I've got a friend of mine who developed an app friend of a friend who developed an app you could cough into the audio and it would then be able to diagnose the top 5 or 6 bronchial diseases. I think that was sold to Merck or Pfizer, I'm not sure which one, but they're out of
Yeah,
Queensland
brilliant.
University. And so is that the type of thing, that diagnosis part, or is it health and lifestyle part? What part of health tech are you
Yeah,
interested in?
we aren't focused on, we don't do biotech, we don't do hardware medical devices. We will do software as a medical device, and we'll do any other B2C, B2B software system that supports and improves the health and well-being of consumers, including supporting healthcare providers make changes and do what they do best. So it's quite broad. Like, we have on our roadmap technologies that address different ways of dealing with mental health issues. Some are dealing with how to create resilience over time and therefore avoid mental health issues. Some are responding to better methods for training PTSD, as an example. And then we've got others that are able to accurately diagnose in real time a melanoma. The same technology is able to accurately, in real time, tell you what mineral on that rock is, using a combination of camera technology and an AI platform. And so it's quite a broad spectrum of health tech that we find ourselves getting involved in, including one organisation I'm working with quite closely now that have developed a new mass cardiovascular screening technology that allows an entire country to do a whole of population cardiovascular screening. Now, why does that matter? Well, because guess what? 1/3 of all global deaths, so 1/3 of all global deaths are due to cardiovascular disease. And the way that healthcare is currently dealing with that problem isn't addressing the problem. And so, and in fact, the way that healthcare currently determines whether you've got cardiovascular risk or not is no better than the flip of a coin. It gets 50% of it right and 50% of it wrong, which means you may walk out of a doctor being told you are not at risk of cardiovascular disease, and a week later have a stroke. So there are some clear challenges and therefore significant opportunities in the way in which healthcare can be improved. And so, there are some really, really fascinating and extraordinary founders with some terrific innovations doing some wonderful things. And I'm currently a mentor with the Luminex health tech program in the Gold Coast. I'm a mentor with the UNSW Founders 10X Healthcare cohort as well. And in those places, you find founders doing some quite extraordinary things, solving some really big world problems in really innovative and unique ways.
What's the capital market like? Is there still an enthusiasm to fund these businesses, or are they fighting tooth and nail to get a buck?
Look, capital markets go through usual cycles. Some periods it's easier than others to raise capital. At the end of the day, though, investors are always drawn to innovations that are led by solid founders with a strategy that's been well thought through and product evidence of the likelihood of downstream product market fit. So I think like all things, if you've got a good product, a good team, and you can pitch and sell that proposition well to investors, you'll always raise money.
Got it.
That's
So
not
the 200
challenge.
that you've seen, of the 200 you've seen, that you're excited about a dozen. That tells me that there's a whole bunch of there, 180 so, also ran or businesses that you didn't feel that we're going to cut the mustard. So just being in health tech's not enough. It's having that special X factor. Is that what you're saying?
No.
Because
So
let me,
no. I think what you said then wasn't quite right about the other 190 odd that we have dismissed as opportunities for what we're looking for. So we're a venture capital business. And as venture capital businesses, we're looking for companies that are going to grow 100-fold. So these are businesses that are going to become potential unicorns, right? Most of the other businesses are going to become nice, in my opinion, nice, small, $5, maybe $10 million revenue companies. those
Got it.
aren't backable by a VC, but they are absolutely potentially backable by angel investors and other investor interests. So it doesn't make them not
Got it.
viable propositions. It just means that they're never going to grow at a scale that warrants what we're looking for as a venture capital investor. Quite different to what a angel investor or other investor might see in a business like that.
Perfect. Thank you for tidying that up. I appreciate it. So, when it comes to managing investor relations, and in the role that you obviously had in the past, and as part of your process you go through now, what are the two or three things that you feel are the most important things to bring to the table when managing investor relations?
I'm smiling because I got the best piece of advice from my biggest shareholder in my last company when he first became a shareholder. And he said to me, he said, Klaus, just want you to know, I just want you to come to me and keep me updated, informed. I don't care whether it's good, bad, and ugly. I just care that I heard it from you and didn't read about it. And so transparency, being open and honest and timely in how you communicate with your shareholders and investors is what's critically important. Investors understand when they're getting behind an early stage business, their ups and downs. They just want to know that you're not bullshitting them, that you're telling them what you're doing, what you've learned, what you're going to do differently, what's changed, that you're being open, honest, and transparent about all of those things. And don't think that it's your job to always go to your shareholders drumming up and getting them excited or trying to fluff up or, sugarcoat something that actually is rotten. If it's rotten, call it out and say that was rotten. We just spent 150 grand doing this thing and it didn't bloody work. And here's what we learned about it. Here's why we're not going to do it again. Just be honest is the most important thing when dealing with investors. If the investors you've got on board don't appreciate that, then you've made the other strategic mistake that founders make. You've got the wrong investors on. Don't get the wrong money into your business, because that will become your biggest nightmare. And I've certainly experienced that too. So
it's fantastic.
Yeah.
Yeah, look, there's a through line through this conversation that it's about identifying the right customer, identifying the right investor, being qualifying people out. It's qualifying people out when it comes to a sale or a customer, but also it sounds to me like qualifying people out when it comes to investors as well.
So just think about what you just said. You said that a founder has to be skilled at capital raising, shareholder management, pitching, selling to end customers, product direction and management, strategy, sales, marketing, technical product development, building, budgeting, hiring the right people, managing those right people. Shit. That's a lot. That's a lot for a founder to need to become an expert at, right? And the reality is they don't, and they learn through failure. And if they can avoid that, then that's a good thing. It's why at Dromoro, when we built this business, we decided to couple with our venture business a technology and commercialization studio, a team, many from my former business that have come and joined me in this venture, that are skilled in understanding how to build and bring to market successfully and efficiently and capital efficiently products. And so, one of my pet hates that I see time and time again by founders, I see this call for, I'm looking for a CTO co-founder. Okay, so to translate that is you're asking for an arranged marriage.
Yes.
Like, why? I don't understand why people think that's okay. It is almost always going to lead to disaster. A true co-founder, is someone that was with you who invented and helped you invent what you're bringing to market. Okay, you might have met them a year after they've had an idea, but they've actually been there and they've gone on the journey, the sweat journey early on. Versus if you need a CTO in a business, terrific. If you want to allocate some vested shares, in other words, give them 5-10% vested over the next 3 years based on their performance, terrific. They don't need to be called a co-founder. They're your CTO. and recognize as a technology company that you're going to have 3 CTOs during the journey and growth of your business, because different CTOs are skilled at supporting different scales of the growth of a company. Rarely does a CTO transition well from one scale to the next scale. So
got it. I guess the whole thing there with people trying to bring in of co-founders is trying to get skill without having to pay cash out, because cash and energy are the resources that are most in high demand in a startup,
sure,
right?
but you don't need to call them a co-founder. Even if you've allocated 30% of your shareholding to that individual and sensibly vested, which is the other thing that people don't often do. So in other words, earn the right to still be here 3 years from now, and you'll own all of those shares. Then that's fine, but you don't need to call them a co-founder. Call them what they are. They're a CTO that you happen to be paying through with equity.
Through paper.
Right? But you don't need to be
Got it.
calling them a co-founder. That's a mistake. You're the founder. Accept and acknowledge that that's the position. If you're genuinely in that early stage and you're still thinking about it and you're at ideation and you need someone to help you ideate the idea, and you need someone to do it, sure, but they don't have to be a CTO. They might have some other skills. So they might be a marketing person or a salesperson or whatever. It doesn't matter. But don't make the mistake of thinking you're hiring a co-founder CTO. That irritates me no end, and I just see it all too often.
Well, Klaus, while we're on the topic of irritating you, what else gets on you, gets your goat in the process? Because you're dealing with and seeing lots of different businesses. What are the outward signs that things need to be dramatically fixed, or what gets you upset and you need to fix quickly?
So look, I don't think I get upset about. I respect and want to back every single founder having a go. Right, being a founder is hard, and being disrespectful of their attempt at that journey is just, disrespectful. There's no need to do that. They may not get the first venture right. They may have to go through 2 or 3 ventures before they find the one that works. Doesn't make what they're doing wrong. I think what I always find it's more disappointing than frustrating is founders who don't listen. Who make the mistake of thinking they know it all. They don't know it all. In fact, they know virtually not much at all in reality. And acknowledging that that's the case is important. Even if you've been an experienced executive in a company and you've gone into launching and starting your own company, that's no guarantee you're going to be successful. In fact, more likely it's going to be a guarantee for why you're going to fail, because you now think you know it all and you don't know it all. There's a lot you don't yet know and need to learn and become aware of. So the best founders I see are the ones who surround themselves with quality advisors and people, and who listen carefully and who challenge their own thinking incredibly well. And importantly, who figured out they know what they don't know, and therefore that they needed the right advice for what they know they don't know, versus others who make the mistake of thinking they might know it all, or know more about something than they actually do.
They're conscious of their incompetence in certain areas, and they've looked to fill those roles.
Yeah, I think more gap in their knowledge than I would call incompetence. Right. So this isn't about them being foolish. This is about them just simply understanding, recognizing where they have gaps in their knowledge that they need to satisfy with the right skill sets from elsewhere. And what we seek to bring in tomorrow to founders is support them with such a broad set of skills that there's almost nothing we can't support them with in terms of an additional capability to help them think through their business model. Our job is to improve the likelihood that they're going to have early success in their venture, improve the likelihood that they're not going to waste early capital in building an MVP, and improve the likelihood that their journey is going to be an enjoyable one and not an excruciating one, which most founders, if they're being honest, would describe their journey as excruciating.
I think Musk said it's like chewing glass and staring into the abyss.
That's pretty accurate. It's pretty accurate.
Mate, as we wrap up, because I know we're almost at the hour here, is there are there 2 or 3 bits of advice that you want to give budding founders, startup people that you think that they should know at this time?
The key mistakes I see founders make I'll try and 'cause this is what I spend most of my time repeating myself around every time I talk to every founder is how do you know it's a problem that wants to be solved? Careful choice of words. Problem is certainly there, but how do you know it wants to be solved? How do you know that the people that are experiencing the pain actually want that pain removed? Now, that to me is about determining, validate that there is a market opportunity for what you're offering. If you're shifting people from a status quo, whether in pain, to a new solution where they're in less pain, that delta needs to be significant enough for them to want to do it. And so getting people to change behavior and to change from where they are to doing something different is not trivial. And founders underestimate too often the kind of the benefit, what will cause someone to shift from one place to another. If you aren't saving them 50% or 80% in cost, or shortening their activity by 50, 60, 80% or 10x, if you aren't having a profound impact, you won't get them to do that. That's kind of the first thing. The second thing is to properly identify and think through fully the whole commercialization strategy for what they're doing. And that isn't just about pricing. It's about understanding who you're selling it to, what the value to that to those sectors are, what pricing strategy you're going to adopt, what does the product need to do to satisfy and meet the needs of that market successfully, and do that homework before you build anything. Because when you've determined your commercialization strategy, that will almost always steer and guide the product you're going to build. Too often people think about the product and don't think about the commercialization strategy. If you think, so I'll give you an example. If your commercialization strategy is ultimately needing to ensure that I'm going to secure 5 minutes of engagement with an end user around these particular key functions, and that's core to the success of the business, then you better know that before you build it. And so really think about that. The kind of third thing is, what is the one metric that actually drives growth in your business? The one metric. And it's the one metric. There are always two or three others that are supporting metrics, but there's always one metric that is a fundamental driver to long-term success. And if they haven't thought about that hard enough, then all the other decisions they make won't work.
Can you give me some examples of that one key metric in businesses that you've seen and worked with?
Yeah, so one key metric in one business we're working with now, for example, is repeat engagement with the product a certain number of times in a given month is deemed as success. If they aren't getting repeat engagement with that product in a given month, then they've failed. That's one example.
And what was the one key? And if you can't say, that's okay. But what was the one key metric you measured in First Group?
So in us, it was the percentage of the appointments that were being booked online versus over the phone. That was a key driver.
Why did that matter?
Of success, because it determines stickiness and value creation. Right? If you weren't shifting enough of the appointments that people were taking over the phone online, then you weren't creating enough value and reason for them to stay and stick to what you're doing. And that was a kind of a key metric that we cared a lot about.
How did you demonstrate value back to the provider? Did you actually show them that number and say you used to have 100 people calling and now you've got 50 people or 50%?
Absolutely, by presenting the statistics of not only the number of bookings they were getting versus over the phone, but also the repeat bookings they were getting from their patient base as well. And so that was certainly key to a key driver of the business for many, many years, and remains still true today. But there are other now key drivers that you think about on top of that now when you're thinking about that kind of that process.
That's fantastic. Please do, because so far we've got problem that needs to be solved. We've got commercialization strategy, understanding that key metric. What's the number, not the range of numbers? What's the one single number? What else have you got?
I think lastly, it's what's success look like? So think forward 5 years from now and go, what does success actually look like for this business? And let me unpack that for a moment so that I've
Yes, please.
I'll
Yep.
give it some context in a healthcare context, and a founder that I had this conversation with. So this founder had built a product to help address, both identify and manage mental health in children. Now, I don't know whether you realize this,
Right.
but mental health develops in children from the ages of 4 and 5 and is a significantly growing international problem. And there are literally hundreds of millions of children in the world suffering mental health issues that are occurring at an early age that aren't being detected. And this product allows parents to detect that there is a problem and provide that child with support. And when asking this founder what success looked like for their business, they said to have 20,000 subscribers on the platform in the next 3 years. And I went, so there's
That's a reasonable answer.
There's 100 million people children on the planet with the problem, and you only want to have addressed 20,000 of them. Have you actually made an impact? Is what you're doing really matter? What was the point?
Great question.
What was the
point? What do you say?
So they went back and thought about what would it take to get to a bigger number. And my argument was, we'll figure out the plan that takes you to 10 million subscribers in 5 years and what's required to do that. When you reset a more meaningful and more sensible and more impactful target aligned to the values of what you're trying to create, so the purpose behind what you're doing and why you're doing it, that will lead you to make strategic choices and decisions that get you there. Now, they might not get the 10 million, but I reckon they'll get to 1 million. That's way better than the 20,000 that has basically, they might as well not bothered getting out of bed. And so I think for me, it's just, asking yourself realistically, where do you want to be in 5 years? And does that really matter? And if you can work that out, you'll find that you'll develop a strategy that gets you to a more successful place than if you hadn't had the clarity of thought about that. Some might call it the North Star, but it's okay, this is where I'm going, and then how do you get everyone else on that journey to understand where you're going and why?
Klaus, thank you so much. This has been a really revealing conversation. I love your ideas and your thoughts about that. So I'm going to have to wrap it up because I know you're a busy man. You've got stuff to do. I know we could probably talk for another hour. Thank you so much for taking the time today. Really appreciate it. And I hope to talk to you in the future.
Matt, it was a great joy. Appreciated your questions and insights, and gladly continue the conversation and go deeper around any particular one topic, should that ever be of interest. Thank you.
I think so. Thank you, mate. Bye now. Bye.